It's when two or more health and social care professionals learn with, from and about each other to improve interprofessional collaboration and quality of health care. Patients themselves enjoy being cared for by an interprofessional team. Staff enjoy the ability to work effectively with other people, and it seems from the research that certainly patients suffer less risk incidents and their health outcomes may well be improved by that. So it's a win-win for everyone. Palmerston North is a very interesting interprofessional education learning activity around cancer and life-limiting illness.
By learning together, they will be able to work together. If you study in silos and then suddenly on the work floor you have to work collaboratively, you have no idea what other people can contribute to the patient care. If you start learning that during your education, that will definitely have benefit. Once you're out in the field and actually deal with real patients. Suddenly their eyes open and they understand what a dietitian does or a physiotherapist does. They know what they can expect from them. They can even take their head on sometimes and ask the questions that would normally be asked by a physiotherapist.
What we see is those students working together, they can bring to their work what they've learnt from the different disciplines within their team, and they can bring that into their practice, and I think that's what the staff see. They can see the students working collaboratively, and we can learn from the students as well during the process.
They arrive not really sure about what this is all about, and it is really clear by the end of the presentations that they totally understand what it is to be working as part of an interprofessional team, to be interacting and to be talking to a real patient with real problems on a real patient journey. It is so wonderful to see the students using the Te Whare Tapawha model. The presentations are so heartwarming, and for them it's like, gosh, this really works.
Interesting and challenging experience to begin with. Coming into it, not knowing anyone else, they're all fresh faces from different disciplines. But once you get to know everyone, it made it a lot more easier to talk to everyone else and then see how we can all work together to work on this case that we were working on. Learning a lot more information about everyone else was the best part from it. The ability to work as a team amongst all the health professionals and how that they all come together and bring their own unique abilities, and how we can use those and the knowledge that they have to come to a plan and a goal for our patients.
I really enjoyed getting to work with other disciplines and getting to discuss kind of our roles in patient care, and actually really seeing the scope of how we can overlap and interact and benefit that overall patient in the end.
As single healthcare professionals, we're not going to cover every base, and we're not expected to. That's why we work in a team together, and kind of having that freedom of communication to actually want input from other people instead of, sticking to a really rigid hierarchy. A lot of the professions that we're working with are also in their final years. As opposed to previous times when we've been a bit younger, we actually have a stronger grasp of what we do in our roles as health professionals, and it's kind of more realistic and kind of applying what we do know and how we actually would manage the patient in a few months' time.